Have you ever wondered why your blood pressure stays elevated, even when you watch what you eat and take a walk most mornings? Today, I am going to show you a morning protocol that targets the real source of that problem. Not just the number on the cuff, but the three systems underneath it that are actually driving it up. And if you stay with me, you will also learn the one mistake that destroys this method. Most people make it automatically. They do not even notice they are doing it, and it quietly cancels the entire calming effect. I am Dr. Zion Adetola. For over 2 decades, I have worked closely with aging hearts, narrowing arteries, and circulation that no longer behaves the way it once did. And in that time, I noticed something that most conventional advice misses entirely. Many people receive treatment for high blood pressure. Very few are ever taught how to retrain the body that is generating it. That is the gap this protocol fills. It is short, it costs nothing, and it was designed specifically for adults over 60. Not because your body is failing, but because your body now operates under a different set of rules. Now, I want to be honest with you. The standard advice is not wrong. Reducing sodium can help. Regular walking can help. Medication can be absolutely essential. But those tools often work on one layer at a time. They do not always correct the underlying way an aging artery behaves. And that is the real problem we are addressing today. Because pressure is not just a number. Pressure is a response. Your vessels respond. Your nervous system responds. Your hydration status responds. When all three stay tense, depleted, and stiff, that number keeps climbing. Even when you feel like you are doing everything right. Let me give you a picture. Think of an old garden hose. When it is new, it bends without resistance. Water flows through it easily. But once that hose stiffens, every pulse of water hits harder against the walls. The same flow meets far more resistance. That is precisely what happens inside aging arteries. They lose their elasticity. They become less forgiving with each heartbeat. The heart pushes into a tighter system, and the reading on the monitor rises. Here is the good news. Stiff does not mean permanent. Your arteries are living tissue. Your nervous system can be trained. Your fluid balance can be corrected. And that is exactly what this 3-step protocol targets. It works in one specific order. First, we train the vessel walls mechanically. Then we calm the stress circuitry. Then we restore fluid without triggering more tension. And I want to say this clearly. The order matters a great deal. If you scramble the sequence, you lose part of the benefit. I will explain exactly why later, because that detail changes everything. By the end of this video, you will know precisely what to do tomorrow morning, step by step, breath by breath, sip by sip. And if this helps you, a like means something real. It tells this platform that this kind of content deserves to reach more adults who are quietly struggling with the same problem. Now, step 1. And this is the one that surprises people most. Muscle tension. That sounds backwards. At first, you might think effort would raise pressure, not lower it. And in the short term, yes. While you are exerting, pressure can rise. But the adaptation that follows is what matters. That is where the real training effect lives. And the method here is not jogging. It is not brisk walking. It is not lifting weights. It is isometric work. Static holds. You hold a position. The muscle contracts. The joint barely moves. In this protocol, you will use 2 holds. The wall sit and the forearm plank. That is step 1. 6 minutes total. The structure is simple. 2 minutes of wall sit, 2 minutes of plank, then 2 more minutes of wall sit. If you are just starting out, do not worry. You will not begin at 2 minutes. I will give you the beginner version in a moment. Start where your body actually is, not where you think it should be. But first, let me explain why this works. Because once you understand the mechanism, you stop looking for reasons to skip it. During a static hold, the contracting muscle compresses local blood vessels. Blood flow is partly restricted for a short period. Then you release and blood rushes back through that region. That repeated cycle of compression and release sends a training signal directly to the vessel lining, the endothelium, the inner surface of every artery. And the endothelium is not passive tissue. It regulates how vessels widen and relax. So when you do isometric holds consistently, you are not just tiring your legs, you are coaching your arteries. Several large reviews have confirmed this. Isometric training can reduce blood pressure meaningfully, sometimes more than conventional exercise. That surprises many people because static work looks so unremarkable. Too quiet, too ordinary. But physiology does not care about drama. It cares about signals. And this signal is powerful. Controlled compression, followed by release, teaches the system how to respond. Think of it this way. You are giving stiff vessels a rehearsal, not a punishment, a rehearsal. Now the practice. Stand with your back flat against a wall. Slide down until your knees are comfortably bent. They do not need to be exactly 90 degrees. A higher position is perfectly fine. Back supported, feet flat, and breathe normally. That last point is critical. Breathe normally. Do not hold your breath during the wall sit. That single mistake can drive pressure upward fast. I will say it again because it matters. Effort is allowed. Breath holding is not. If the position feels too intense, rise a little. Make the angle easier. You should feel the work in your thighs, not dizziness, not chest tightness, not panic. Then move to the forearm plank. Elbows directly under the shoulders. Body long and relaxed. Neck neutral. And again, breathe. Slow, steady, unforced breath. Your plank can be on the floor or elevated on a bench or the edge of a firm bed. An elevated plank still counts. For many adults over 60, it is the smarter place to begin. Now, the beginner version. 30 seconds wall sit, 30 seconds rest, 30 seconds plank, 30 seconds rest. Repeat that cycle once more. That gives you 2 minutes of actual work. Next week, add time gradually. 45 seconds, then a full minute, then a little more. Do not jump straight into 6 minutes because you feel motivated on day one. Your arteries prefer consistency over heroics. And here is something I want you to sit with. Static work feels quiet, unremarkable from the outside, but internally, it is creating a clear message. The muscle presses, the vessel reacts, the release follows, the system listens. That is why step 1 comes first. We create a mechanical signal before we calm the nerves, because after the holds, the body is primed and ready for what comes next. Before I show you step 2, I want to ask you something directly. How long can you hold the wall sit today? Write it in the comments. Even if your honest answer is 20 seconds, that number tells a real story. And if you are already doing static holds, tell me which one feels more manageable, the wall sit or the plank. Those comments help other viewers understand they are not starting from zero alone. And they help me understand where this audience actually is. Step 2. Resonance breathing. This part lasts only 2 minutes, but it changes the entire tone of everything that follows. Sit down. Close your eyes if that feels comfortable. Let your shoulders drop. Then inhale through your nose for 5 seconds. Exhale through your mouth for 5 seconds. That gives you 6 breaths per minute. Not fast, not sleepy, just steady. Why 6 breaths? Because that rhythm tends to synchronize breathing with heart rate variability and autonomic control. In plain terms, it helps the body shift out of alert mode. And that shift matters more than most people realize, because hidden tension drives blood pressure up all day long. You may not feel stressed in the obvious sense. No argument, no crisis, no panic. And yet your nervous system can still be running slightly braced, slightly guarded, slightly on edge. That background tension narrows vessels. It speeds the pulse. It raises the baseline reading before you even sit down with your cuff. The vagus nerve is part of the braking system here. When breathing slows in a controlled pattern, that brake engages more fully. Heart rate eases. Vessel tone softens. The whole system receives a different command. Not fight, not rush, restore. That is exactly why I place breathing after the isometrics. First, we create useful vascular demand. Then we tell the body to release. Effort, then regulation. That sequence has a reason. Here is how to do it well. Breathe quietly enough that your face stays relaxed. This is not a performance. You are not trying to fill your lungs dramatically. You are creating rhythm, smooth and unforced. Count in your head if it helps. 1, 2, 3, 4, 5. Then out, same count. If 5 seconds feels too long right now, begin with 4. 4 in, 4 out. Work toward 5 as the weeks go on. That pacing is the sweet spot. And please put the phone down. I mean it. If you breathe while reading notifications or checking messages, the benefit fades, because your eyes may be still, but your brain is not resting. It is scanning, reacting, preparing. And this step depends on a very different state: presence, not silence, not incense, not an app, just 2 undisturbed minutes. That is all it takes. Many people tell me this becomes their favorite part of the routine, not because it feels dramatic, because it feels immediate. They notice warmth in the hands, less tightness in the chest, a softer pulse. And no, that does not mean you stop taking medication. If your physician has prescribed blood pressure treatment, keep following that plan. This protocol is a support strategy, not a replacement. Our goal is better physiology, not rebellion. Sometimes improved physiology helps your physician reduce treatment over time. But that decision lives in the clinic, not in the comment section. After those 2 minutes, your nervous system is quieter, your vessel tone is softer, and the body is ready for the final step. The step that most adults underestimate completely: water. Not coffee first, not juice first, water. But not just water. Water taken the right way. Step 3 is conscious hydration. 2 minutes. You are targeting around 16 ounces, roughly 450 to 500 milliliters of plain water. And the method is pacing. Small sips every 10 to 15 seconds. Not a fast chug. Not a race. This matters especially after 60 because the thirst signal becomes less reliable with age. Many adults are chronically underhydrated without ever realizing it. When fluid intake stays consistently low, blood becomes more concentrated. The body compensates. Vessels may constrict. The kidneys guard fluid more tightly. The circulation begins behaving defensively, and pressure rises as a result. You did not change your diet. You did not change your stress. You just did not drink enough water. Now here's the part that catches people off guard. If you gulp water too quickly, the body can read it as a stress event, a sudden load, a sudden stretch, a reflex response that works against everything you just built in steps 1 and 2. But slow sipping behaves entirely differently. It extends the calming phase. You have already trained the vessels. You have already quieted the nervous system. Now you reinforce that state with measured, deliberate hydration. This is why the order is not optional. Take the glass, sip, pause, breathe normally, sip again. Small rhythm, no hurry. If the water is very cold, bring it closer to room temperature. An icy shock, first thing in the morning, works against the calm you just created. And if 16 ounces feels like too much on day one, start with 10 or 12. Build gradually. The habit matters far more than the precise volume on your first morning. Now step back for a moment and look at what just happened. Step 1 trained vascular flexibility through controlled muscular compression and release. Step 2 told the autonomic system to downshift. Step 3 supported circulation with slow hydration while that relaxed state was still active. That is not random wellness advice. That is sequencing. 3 separate mechanisms, 1 short window, 1 integrated result, because pressure is multi-causal. So the answer has to respect that. And if you are thinking this sounds too simple, I understand. Most effective routines do. The body often responds better to clear, repeatable signals than to complicated ones. And nobody gets credit for complexity at 7 in the morning, especially not after 60. What wins is a system you will actually do. On tired mornings, on busy mornings, on ordinary mornings, that is where habit design becomes the deciding factor. So let me show you how to lock this in. Use habit stacking. Attach this routine to something you already do automatically, something fixed, something dependable. Right after you brush your teeth, right after the kettle starts, right after you feed the dog. Pick one anchor, just one. Then make the rules simple. After I start the coffee, I begin the wall sit. The brain responds well to predictable links. That is how habits actually form. Do not rely on motivation. Motivation is a visitor. Structure is what stays. And if you want this to stick, prepare the environment the night before. Put the mat out. Set the water glass where you will see it. Remove the small obstacles, because every extra decision drains your follow-through. Little inconveniences become excuses faster than you expect. One more practical note. The routine is 10 minutes, but 10 minutes can disappear. Phone calls happen, grandchildren call, life interrupts, so make the backup rule even simpler. If the full sequence is impossible today, do the minimum. 1 wall sit, 6 breaths, half a glass. A partial routine keeps the habit alive. Missing once is not the problem. Breaking the pattern entirely is. That is the difference between a rough morning and a lost routine. Now, the mistakes. Because this is where most people quietly lose the benefit. They do the right steps, but they do them the wrong way. Mistake number 1, holding your breath during the static holds. This is the most common error. And frankly, the most risky one. When effort rises, many people brace automatically. They lock the throat, they strain, they stop breathing. And that pressure surge is exactly what we are trying to avoid. So during the wall sit, keep one phrase in your mind. Effort in the legs, softness in the breath, same with the plank. Tight body, open breathing. If you cannot breathe normally, the hold is too hard. Modify it immediately. Rise higher on the wall. Sit. Elevate the plank. Shorten the interval. Progress should challenge the muscles, not overwhelm the system. Mistake number 2. Turning the breathing into a distracted ritual. You sit down. You close your eyes. And then one eye drifts to the phone. One message becomes 3. One headline creates anxiety. The nervous system tightens again. And the entire point of step 2 is coherence, not multitasking. Protect those 2 minutes. It is a small appointment with your own circulation. Mistake number 3, drinking the water too fast. I understand why people do it. They want to finish, move on, mark it done. But this protocol is not a checklist. It is a flow. The slow sipping is part of the regulation. It tells the body we are safe. We are not rushing. If you gulp the water, you break that flow, and you lose the benefit it was meant to reinforce. Mistake number 4, starting far too aggressively. This happens often. Someone feels inspired. They go straight into 2 minutes of wall sit, full plank, maximum effort. Sore legs the next morning, lightheadedness, and no routine on day 2. That is not progress. A better beginning is humble. 30 seconds, maybe even 20, because confidence grows from completion, not from punishment. And there is one quieter mistake that I see often. People treat this protocol like a test. They become tense about doing the relaxation correctly. That defeats the point entirely. This routine is not pass or fail. It is signal and response. Give the signal consistently. Let the body learn. Now let me tell you the nuance I promised at the beginning. The one that can collapse the whole routine. Most people assume the 3 steps are interchangeable. They are not. If you drink the water first, then move into isometric effort, you may feel heavy and uncomfortable. If you breathe first, then strain and hold your breath during the holds. You erase the calming effect you just built. If you do the holds last, after the nervous system has already softened, you often reintroduce tension right at the end. So the sequence is fixed. Isometrics first, breathing second, hydration third, mechanical training, neural downshift, fluid support. That order is the invisible structure of this whole method. When people tell me the protocol did not work, I almost always find one of 2 problems: wrong intensity or wrong sequence. Precision matters more than enthusiasm here. Think of the body like an orchestra. The vessels are one section. The nerves are another. Fluid balance is another. If they enter at the wrong time, the music is messy. If they enter together, the system settles into rhythm. Now, let me give you a realistic timeline. Because expectations matter. Some people feel calmer after the very first session. Warmer hands, easier breathing, less morning tension. That is possible. But the deeper blood pressure benefit comes from repetition. Not one morning, many mornings. Give it a week to feel the rhythm. Give it a few weeks to judge the trend and track your readings properly. Same time each day, similar conditions, seated, rested. Do not measure right after climbing stairs, or after an argument, or while you are rushing out the door. That only creates misleading numbers. And if you already keep a pressure log, add one note. Write whether you completed the protocol that morning. Over time, patterns appear. That is where motivation gets replaced by real evidence. By the way, do your readings tend to run higher in the morning or in the evening? I am genuinely curious because that split points toward different patterns in the body. Morning spikes often tell a different story than evening tension. Tell me in the comments. And if you try this for 7 days, come back and tell me what changed. Energy, pulse, sleep quality, pressure, even mood. Those real-world observations help everyone watching, especially the people still deciding whether to begin. Now, the full routine, exactly as I want you to remember it. First, 6 minutes of isometric work. Wall sit, plank, wall sit. Modify as needed. Use shorter intervals if you are a beginner. Most importantly, breathe through every single hold. Never strain against a closed throat. Second, 2 minutes of resonance breathing. 5 seconds in, 5 seconds out. 12 slow cycles. Eyes soft. No phone. No rushing. Third, 2 minutes of conscious hydration. Plain water. Small sips every 10 to 15 seconds. No gulping. No shock. Just a calm, measured finish. That is your 10-minute protocol. Short enough to repeat every day. Strong enough to matter. And here is what I appreciate most about it. Each part addresses a different vulnerability in the aging circulation. Static holds address vessel responsiveness. Slow breathing addresses sympathetic overdrive, the hidden, always-on tension state. Measured hydration addresses the quiet dehydration that many older adults are living with and underestimating. 1 routine, 3 targets. That is also why I call this method an ally, not a miracle. It respects how biology actually works, instead of pretending one trick solves everything. If your blood pressure is severely elevated or you have active symptoms, please seek medical care. Do not experiment alone with dangerous numbers. And if you have heart disease, kidney disease, a history of dizziness or fainting, or any mobility limitations, speak with your clinician before starting. The same applies if you are adjusting any medication. That must always be supervised. I want this to be useful, but I need it to be safe. Because good medicine is not just about effectiveness, it is about fit. Some viewers will ask, can I replace the plank? Yes, often. A countertop plank works. A firm bed edge works. Even a seated isometric squeeze can serve as a bridge. The principle matters more than the specific movement. Controlled contraction, controlled breathing, safe execution. Others will ask, can I do this later in the day? Yes, but morning is ideal for most people. Why? Because it sets the vascular tone early. It interrupts stress carryover before the day gains momentum, and it solves a very practical problem. Morning routines are easier to sustain than evening intentions. Evenings get crowded, fatigue wins, plans dissolve, mornings are cleaner, and for many adults over 60, you wake up mildly dehydrated and physiologically tense. So this protocol meets the body exactly where it actually is, not where we wish it were. Listen, I am not asking you to change your whole life tomorrow. I am asking for 10 well-placed minutes, 10 minutes that retrain, calm, and restore, 10 minutes that speak directly to the body producing the pressure. That is a far better investment than endlessly searching for the perfect supplement or the secret trick. And if you found real value in this today, subscribe. I have more evidence-based routines designed for adults navigating the real biology of aging. And next, I want to do a deeper breakdown on home blood pressure monitoring, specifically the mistakes that create false alarm readings. Because many people panic over numbers that were taken under the wrong conditions, and that confusion creates more stress, not less. One final reminder before we close. Do not stop your prescribed medication because a routine sounds natural or appealing. We are not replacing your treatment. We are strengthening the terrain underneath it. That is a very different goal and a much safer one. So tomorrow morning, do this. Set up your space. Begin the wall sit. Breathe through it. Move into the plank. Keep the jaw loose. Keep the breath moving. Return to the wall sit. Finish the muscular signal. Then sit down. Eyes soft. 5 seconds in. 5 seconds out. Let the pulse settle. Let the shoulders drop. Let the system receive the message. Then take the water. Sip slowly. Pause. Sip again. And end the routine calmer than you started it. That is the protocol. Not flashy, not expensive, but built on how the body actually works. And sometimes that is exactly the point. The most useful medicine is not dramatic. It is repeatable. If you try it for 7 mornings, come back and tell me what you noticed. Not what you hoped, what you actually observed. Because those details matter. The body leaves clues. And once you learn to read them, high blood pressure stops feeling like a random enemy. It starts looking like what it really is. A message from stiff vessels, from a strained nervous system, from quiet, invisible dehydration. Now you have a way to answer that message calmly, clearly, and step by step.